period, at least 75% of the money, which is the entire calculation, is based upon 2 months of payroll, 2 months of average payroll. So could they keep your hours low? That technically they could, but it likely would prevent them from having forgiveness for their loan, so they would then have to pay it back.
Okay, Tanya of Baton Rouge says, when and how will private clubs like Bocage, Tara, Kenilworth, et cetera, reopen?
Yeah. So in regard to those clubs, I think it probably is gonna come back to the orders of the governor and of our mayor here in Baton Rouge, and of course following the protocols, which as we discussed earlier is going to include kind of a new normal with hand sanitizer and mask and probably other protective requirements in terms of distancing. But I can't say for certain, but I'll say it again. I do think that we should have already opened some regions of our state, and some services should have returned to some degree of a new normal based on some of the trends that we're seeing in numbers.
Okay. Amanda for Baton Rouge says, I am a contract gig worker. I was told I qualify for the federal stimulus even if I'm not eligible for state unemployment benefits. Is that your understanding?
All right, Amanda, so a few different things I want to unpack there. A gig worker is eligible for unemployment, all right? So you still have to comply with the unemployment criteria, but gig workers, independent contractors, 1099 employees, you are eligible for unemployment provided that any residual income you're receiving is still below the threshold required for that eligibility. So that may be an option for you. Federal stimulus payment. You should be eligible for a federal stimulus payment. As you know, if you're single, you're eligible for up to $1,200. There is a $75,000 adjusted gross income cap. However, all that does is mean your check would be reduced. So if you're in your 2018 taxes, your adjusted gross was $75,000, and that was the last tax return you filed, you will get a check for $1,200. If your 2019 taxes were the last ones you filed, and let's say that you actually increased from $75,000 adjusted gross up to $77,000 adjusted gross, that's $2,000 over. What they would do is they would assign a 5% reduction. So instead of so they would take your $2,000, they would apply 5% to that, the $2,000 you made over $75,000, and they would reduce your $1,200 check by $100. So you would then get an $1,100 check. Last thing is this: if your income in the last tax year you filed, if your income was over $75,000 as a single person with no dependents, but then in 2020 your income dropped because you lost work, what would happen is when you file your 2020 income taxes, that would be reconciled and you would then get a payment. Now, look, I recognize that would be late, but do know that there is a true up for 2020 if your income did drop. Actually, I already said last thing, so last thing, sorry. If you are a gig worker, you should also be eligible for the Paycheck Protection Program loan. You can look that up, and if you want to reach out to our office, we can send you, there's about a 7-page frequently asked questions document that explains how to do the calculation. You basically look at your Schedule C filing for your taxes, and you can use that to calculate how much you're eligible for, designed to hopefully replace or give you some degree of income over a 2-month period. So unemployment, you should still be eligible for an economic relief payment, and you should be eligible for a Paycheck Protection Program loan. You can't have unemployment and Paycheck Protection Program during the same period of time.
Okay. Michaela of Port Allen says she's on Social Security and not required to file taxes. So when would she get her check, and how does the government, even if she doesn't file taxes, even know she's out there?
Yeah, so Michaela, the Social Security Administration and the IRS actually worked out a data sharing arrangement. So however you receive your Social Security benefits, if I understood that correctly, your retirement benefits under Social Security, you should receive your economic relief payment under that same mechanism. So if you get a check deposited or a monthly deposit in your checking account, then that is how that payment will be made to you in that same mechanism, and it's through that data sharing agreement. Now, you can, if you want to be extra sure, you can go to the irs.gov website, irs.gov. On the left side, there is a link for non-filers, and you can go click on that and you can update your information there, but because of the data sharing agreement, you should be taken care of. Again, if you're in a financial jam, please feel free to reach out to our office and we'll see if we can help track that down.
Okay, Malcolm from Walker says, are there any other avenues for my small business for the PPP as his bank, which I won't list his bank, missed the first round and does not look like they can get him into the second round?
Okay, Malcolm, I'll tell you, it really has been amazing seeing how our banks and credit unions and other lenders have stepped up and just done an amazing job in getting the loans. For example, in the first tranche, $5.1 billion in loans were actually issued to businesses in Louisiana. What I would urge you to do, and Malcolm, I cannot overstate how quickly you need to do this because they've already burned through it. I think in the first 2 days, it was like $50 billion of the funds we put forth, so it is going to happen very quickly. I would urge you to reach out to other banks you have a relationship with. That could be a bank you have a mortgage with, you have a credit card with, you have a savings account with, you have a car note with, another lender. I would reach out to them, I would talk to them, find out if they're processing applications, what period of time they can process them over. Malcolm, it's been amazing. I've spoken to people that have had loan approval within 36 hours, and I've talked to people that submitted on day one and still haven't gotten an answer yet. Some of the big banks, unfortunately, and I'm painting with a broad brush, but unfortunately some of the bigger banks have not done a very good or efficient job at this. Some of our smaller local banks have just, the statistics are amazing at how quickly some of our local banks were able to get these things processed, and of course credit unions and other lenders as well. And so big shout out to some of those banks. And last thing, Malcolm, we did set aside $60 billion of this last tranche to communities that are kind of underbanked or underserved. And so there may be some banks or that you have relationships with that are actually part of this set-aside program that even when the other money runs out, they still may have access to capital. But please, please move quickly. And that goes for anyone out there that thinks they need a Paycheck Protection Program loan, forgivable loan. Please reach out to your lender or lenders as quickly as possible. The reason it's important to reach out to one you have an existing relationship with is because under the Banking Secrecy Act, they have to verify your identity, and in some cases that takes a longer period of time and may delay, and so some banks are not accepting new clients.
Is your appreciation of what's going to happen in Washington that, you know, PPP version 2.0 is going to run out of money and there's going to be PPP version 3.0, and how many versions are we going to have?
Some of the initial estimates indicated that that there would be a third tranche that's needed, but at some point when you're reaching $1 trillion in fact in excess of $1 trillion perhaps in loans, I think you've got to call excess at some point. Let's keep in mind, Peter, that this is designed to really address the biggest depressed period or the biggest decrease in economic activity, trying to provide that lifeline. And so I am hopeful that what we're able to do is by doing a long-term recovery bill, we're able to help offer long-term recovery to some of those remaining businesses. In addition, the EIDL program, the Economic Injury Disaster Loan Program, is out there and allows businesses to borrow funds. We did replenish that one, in fact, increased borrowing authority by over $300 billion in the last piece of legislation. So bottom line is, jury's still out. We're going to have to look and see what the needs assessment shows and have to make a calculated decision at that point to determine if we're going to go with 3.0 replenishment or not.
Okay, this comes from Ricky in Baton Rouge, and he says, how are you going to solve the unemployment problem? Adding $600 a week on top of what the state already gives is too much, and employees won't come back to work.
Ricky, I'm going to say amen. Look, I wasn't a sponsor of that. I wasn't a sponsor of that provision. I did believe that we needed to make some enhancements to unemployment, which including opening it up to local and state government employees, not-for-profit employees, gig workers, independent contractors, self-employed, and others. I supported those measures, but I do not support, and it's really hard to defend a scenario where you can have someone actually making more money by not working. I just, normally there's some type of calculation or comparison to what your income was before you applied, before you drew unemployment, and that effectively, to a large degree, is thrown out the window. So I think that in some cases, you're actually providing a perverse incentive, and I think that's the wrong move. There is something, Ricky, called a Form 77 that allows for employers to file a document indicating that they have offered a job back to a former employee, which should at that point make that former employee ineligible for unemployment assistance. As I understand, that process is not working perfectly right now, but I'll say it again. You can go online. There's something the Louisiana Workforce Commission has under their LA Hire program called Form 77. You can indicate that you've offered a job back, and so to that employee, and that should make them ineligible for unemployment. If that's not working, I'd urge you to send a letter to do the same thing, because we do not need to incentivize people to not work. If we're going to get our economy roaring again, we've got to get people back in the workforce as quickly as possible.
You said the process is bumpy. Is that actually happening, that people are calling back employees to work, filing these forms, and the Workforce Commission is sending out notices to the employees saying, we're cutting you off, you can go back to work?
I have probably heard, I'm going to guess, I've probably heard from about 40 different employers, mostly restaurants and smaller businesses, where their employees are refusing to come back to work, and that because they're opting to stay on unemployment, because they're making more money. And the process of reconciliation or enforcement, whereby the Department of Louisiana Workforce Commission is there then going in and telling folks that you're cut off, that has not been working very well so far. But I will say that at some point, because we have provided $139 million to the different inspectors general out there from the different agencies across the federal government to enforce these rules and to make sure that the right things are being done, looking at investigations and audits. I think there is going to be a day of reconciliation, and I think that someone may get away with it for a few months, but that there's a good chance that those people that are continuing to draw unemployment when they've been offered a job back will have to come back and actually pay those dollars back to taxpayers. And look, something, Peter, that I think is important to remind every single person out there. Virtually every dollar, whether it's economic relief payments, the Paycheck Protection Program, forgivable loans, unemployment, all of this is deficit spending right now. So here's the question you have to ask yourself. Is it worth me getting $1 right now in return for asking my child or grandchild to pay back $4 or $5? That's really the question here. And so those people that are staying on unemployment fraudulently and aren't going back to jobs, that's a question that you need to ask yourself. And that one, and also that if there's a day of reckoning, am I going to be able to come back and pay back $5,000 in unemployment, extra unemployment that I received that I wasn't really eligible for, or something along those lines. And so Ricky makes a good point. I think we have to have unemployment. I'm glad we enhanced it to some degree, but I think that there are some perfections that are needed. I've been in touch with the U.S. Secretary of Labor as well on better enforcement mechanisms. We reached out to him about a month ago and trying to work with him on this.
Okay, speaking of the deficit, this is something that various people have pointed out in questions. You know, Republicans used to be deficit hawks, or at least they were thought of as deficit hawks. Are there any deficit hawks left in Washington?
Look, absolutely. I have repeatedly voted for balanced budget, whether it be amendments or balanced budget proposals, and I believe that should be part of our Constitution. We have to have, just like the state of Louisiana has, I think we have to have an enforcement mechanism that requires us to make the difficult decisions. But look, here's the thing. Even though we're talking about really an extraordinary amount of money, I think deficit is going to end up increasing $3.7 trillion this year so far. Unless you go in and address entitlement programs, meaning the non-discretionary spending, then you cannot balance the budget. You can't do it. But I think that it is a crisis. Now, one of the things, and please don't think that I'm I'm saying it's okay, but one of the things that distinguishes what's happening right now under coronavirus from other scenarios, and I'd urge you to have this discussion with some economists that are much more well-versed on this than I am, but I have spoken to a few of them. Because this is global, it's not like we're distorting the dollar in a way that is disproportionate to what's happening in other countries. This is a global pandemic. You are seeing economic activity decrease globally, and so therefore some of the things that we're doing for recovery, as long as we don't go too much out of whack with the rest of the world, the implications will not be as great as if we were to do this on our own, meaning if the U.S. just decided we're going to come in and spend trillions of dollars in deficit spending on our own, and other countries weren't also doing it.
Oh. Well, coming back to the other side, to ask a question from the other side, you say that you voted for a balanced budget amendment. If you had gotten your way, what would be going on right now? We wouldn't be doing any of this?
So balanced budget amendments generally allow for some type of emergency scenario. And so what that could be is it could allow you to temporarily overspend with the understanding you're going to come back and address it, or there could just be, like for example, in Hurricane Katrina, even though I wasn't anywhere near Congress serving at the time, I do believe that in those situations, you've got to immediately go out and do the right thing and get resources out there, but then a mechanism to come back and figure out how you are going to true things up in the future. Let me say it again. You really have to look at these dollars like an investment. And I said before, for every dollar we're spending, you've got to ask yourself the question, is this worth asking my child or my grandchild to pay $4 or $5 for it? Because that's what you're doing. So what you have to do is I think we have to ask the question, is this an investment that's going to provide a return, or is this completely wasting funds? And I think that there was absolutely, positively wasting of funds, particularly in that third coronavirus bill, the CARES Act that was done. But I think the majority of funds in that legislation are going to result and ended up being deemed investments that, while we did incur deficit spending in the short term, it was the right move because it is going to temper the long-term economic impact across the country.
Okay, Donna from Bruley says, why are essential workers at hospitals besides nurses not being paid hazard pay?
So what we've done is we've provided over $550 million in extra funds to our healthcare providers through federal legislation. That is probably somewhere close to about half of what we're going to ultimately provide to them. Number two, we have increased coronavirus supplement reimbursement payments by 20%, meaning that if it's a coronavirus case, if a case would normally get paid $100 for whatever procedure they're providing, they're now getting paid $120. So there's a 20% supplement that's being paid to healthcare providers. In addition to that, we increased the FMAP rate, the federal matching rate for federal assistance programs for Medicaid by 6.3%. And so we have made a number of different investments trying to get additional funds out there to healthcare providers. Ultimately, two things. It's up to the administrators in these places where people are working. Number two, you do have to keep in mind that a lot of these places have had to make structural renovations. They've had to just plow through PPE and other things as a result of what's happening right now. So there has been increased cost or exposure. But ultimately, these are decisions that are being made by administrators, and we're going to continue working closely with them to learn more about their experiences and figure out what we need to do longer term to make sure that folks are being treated fairly.
Okay, Cindy from Livingston says her 20-year-old grandson works hard but doesn't make a lot of money. He's single and does not file taxes and has no children. And so, is he eligible for stimulus money? And if so, he's another one where, like, how does the IRS know he's out there? Okay,
so make sure I got this right. So he works, but he does not perhaps cross the threshold into having to file an income tax return. So I assume that he lives on his own as long as you do not, or no one else claims him as a dependent. Then he would go to the non-filers button, irs.gov, top left corner, or on the near the top left, and go to the non-filers. He would click on that and input his information there. So again, 20 years old, if he works, even if he doesn't, as long as he is not claimed as a dependent by someone, he is eligible for the $1,200, and he would make himself known to the IRS by clicking on that non-filers button on the left side near the top of the irs.gov website.
Okay. Beverly of Zachary says, initially the reason for the lockdown was to flatten the curve so our hospitals would not be overwhelmed, but that never happened. It was shown to be wrong, and so what scientific data support these draconian measures?
Yeah, Beverly, look, I've never dealt with a pandemic before, thank God, but I have had a lot of opportunity to work on disasters like floods and hurricanes and oil spill and things along those lines. And one of the mechanisms that I use and is very helpful to me personally is look at a situation. You then look out and you say, okay, what is the worst case scenario that can happen here? Looking at the oil spill, what's the most amount of oil that can be spilled? Or hurricane, which model shows the greatest strength generation and the worst alignment for that hurricane to hit? And then you start working backwards from there. And so, you'll hear people in disasters often say, we're preparing for the worst, but we're hoping for the best. And that's what you have to do. And so, look, some people come in and they overly scrutinize, in my opinion, disasters, and they'll say, well, look, you bought too much ice and too much water, and you have too many shelters open. You know what? Good for you. I think that people should never be criticized for over responding to a disaster. And so, in this case, models were imperfect because we haven't been through a global pandemic in over 100 years. And yes, they were imperfect. They were. But I think that one of the reasons that the curve flattened faster is because we prepared for the worst, but we hope for the best. As a result of some of the protective measures that we carried out, it resulted in that curve, us not reaching the peaks that were initially projected. Now, Beverly, this is where I think you're ultimately going, and it's probably that, is it time to open up? And I'll say it again, I do think that in a principled way, we need to open up to a new normal, especially in some of these areas that are not seeing cases increase and are more sparsely populated. But I would like to see a modified opening of Baton Rouge even, and of course Zachary all over the parish. I would. I'm not seeing the same trends in numbers that some other people are seeing.
Okay, Faith of Baton Rouge says she doesn't think it's fair that unemployment rate payouts are at one set rate, that the amount should be based on the amount that people were paid before they were unemployed.
Faith, if you want to run the Louisiana Workforce Commission or run this program, I would support you every single day. I agree with you 100%. I do. I said this earlier. I do not think people should profit from a global pandemic, meaning I don't think that people should lose their job as a result of a pandemic and end up making more money. There should be some type of pegging or association to what your income was before. And that largely is how unemployment works, where you get somewhere around 1/3 to 1/2 of your previous income. I'm actually okay. I'm okay with folks making more than they would under the old unemployment program. I am. I think that this is a really incredible anomaly. This is an exceptional case, but I do think that the program, as I mentioned before, is overly generous in some cases.
Okay. Cheryl of Addis says, how are people who go to the hospital for COVID-19 and are unable to pay their hospital bill because they're unemployed going to make it?
Yeah. So Cheryl, a few things. If we have offered up through regulatory as well as through legislation a number of flexibilities to different lenders and creditors and borrowers. And so depending on your situation, there may be flexibility on your mortgage, on your car note, on your rent, things along those lines. In addition, depending on your situation, you may be eligible for of course, the economic relief payment is something that may be helpful as well. You may be eligible for additional assistance, deferral, forbearance on the actual debt. We also passed legislation that actually eliminated a co-share for things such as diagnostic associated with coronavirus. So a number of different, and actually last thing, depending on your situation, Medicaid eligibility may be an option for you as well, because if you lost your job and income drops, then Medicaid could be an option because that is actually, your eligibility is based upon a monthly income eligibility. So that could be an option for you as well.
Okay. Excuse me. Another question is, someone says, this person's also Leslie, I exhausted my claims for unemployment benefits at the end of February. So if that's the case, in other words, I guess you used up your 26 weeks or whatever it is, are you eligible for the enhanced unemployment or continued unemployment?
Leslie, so I've been doing this from memory, which give me some wiggle room here. So my recollection is that, one, if your unemployment is a result of coronavirus, and so that could mean that you were unable to find a job because coronavirus has obviously tanked the availability of jobs in many sectors. Number two, we did extend unemployment eligibility for 13 weeks. So we added additional time for unemployment assistance. And so depending on your conditions, you may be eligible for additional unemployment beyond the traditional period, provided that this is, for one reason or another, tied back to coronavirus. But just to make sure I got that answer right and we understand your exact conditions, please feel free to reach out to our office and we'll see if we can help. I'll admit, like IRS, we've had a little bit of trouble getting in touch with the Louisiana Workforce Commission on occasion, but we will certainly stay on top of it. 442-1731 is probably the best number to call. It's 225, of course.
Okay, Daniel of Covington says, our children's education is not being discussed enough and opening schools should be a priority, but it doesn't seem to be.
Yeah. Being the parent of 3 children, I empathize there. So a few things. One, we have provided the state with about $500 million in additional funds for K through 12 as well as for colleges to largely adapt to this whole scenario of virtual teaching, online classrooms, and things along those lines. And so I don't think there is any reason why our children should suffer. Yes, I understand there may be an adjustment period, an adaptation period to figure out how to migrate to an online classroom type setting. There are some great resources that are out there, Google Classroom, Khan Academy, which actually we've made all of our kids sign up for our Khan Academy account, KHAN Academy, and sign up for that to supplement what they're doing in school, and it's been a great resource as well. But we have provided funds to the state to distribute to different schools or school systems to transition to online classrooms and other services. And I'll go back and say for about the 5th time that I do think that we can open up our economy and our state in some areas under the right conditions, and obviously we need to figure out how to get our schools opened as quickly as possible. Our kids should not suffer as a result of this. You know, one thing my wife reminds me of, she's an educator, works in the school, is that that high school seniors right now, when they were freshmen, got whacked with the 2016 flood, and now, of course, as they graduate, are being having to do these virtual graduations and other things. And so, gosh, that's just been a real tough road for some of them.
Yeah, it is a tough road. This question comes from Ann, who's a real pessimist, and says, what happens if we have stay-at-home orders in place and we have a major hurricane? Like, how would we evacuate?
Yeah.
What would we do at all?
Ann, you're exactly right. And whenever I said earlier that that I always look at worst case scenario and then try and work backwards from it. How do we mitigate it and how do we prepare for it? And that absolutely is one of the planning exercises that is happening right now and has been happening for a few weeks now in Louisiana, thinking about that confluence. Now, the good news, and of course I'm gonna knock on wood and say a prayer on this one, but the good news is that normally in Louisiana, if anything's normal, we don't see really the intense hurricanes until later in August or in early September. And so presumably based upon the trends we're seeing right now, but all this is obviously new to us. Based on the trends we're seeing right now, we would resume some degree of opening in the new normal by then. But there is a planning exercise that's going on trying to answer those exact questions. Are there ways to segregate shelters and other things? Because we can't just say, oh, okay, we're just going to send folks to Mississippi and expect that to be an option, because Mississippi's going through a global pandemic as well. One of the things that's been used in some cases has been hotel rooms that have isolated HVAC systems, and so that could be something that's needed. But if we're in a scenario like Hurricane Katrina, Rita, Gustav Ike, or even, what was it, hurricanes, Gustav and Ike, I think we evacuated in 2008, we evacuated 2 million people. And so that's an awful lot of hotel rooms, and that's why these efforts are being planned right now. But of course, the antibody testing is something that could be very helpful in going into that type of evacuation.
Okay. One last question. Were the racial gaps in infection and death a surprise to you, and what are they telling us?
It was an absolute shock to me. It was. So as you know, I think the numbers peaked out at 72% African American, which was more than double our African American population. So clearly something out of whack with the numbers. Now, some of the other underlying conditions or comorbidities, the top 4 included hypertension, kidney disease, obesity, and diabetes. And so clearly we need to better understand what's going on. We've been in touch with Pennington Biomedical Research Center, who has some of the most foremost researchers in diabetes, really just amazing world leaders there, in obesity and hypertension, and they do have expertise in kidney disease as well. We're also working with Congressman Richmond, with Xavier and other institutions, trying to do a deep dive on these numbers and understand this, because we do need to understand, is there a genetic vulnerability that's there to African Americans? Is it because of these underlying conditions, and is that the sole reason? Is there lack of access to health care? Because you see all these people out there throwing ideas out and say, oh, it's because of this, it's because of that. Look, we can't just guess at this stuff. We need to figure out what it is and not just throw money at the problem. We've got to figure out what it is, which is why there needs to be research into this to figure out what the problem is. And then once we figure out what the problem is it simply an education effort, teaching people about what causes diabetes to those that aren't, that don't have genetic vulnerability there. Teaching people, that obesity does cause you to have greater exposure to coronavirus and other, immunocompromised individuals. Just understanding what it is that is causing that disparity and making sure we address the problem and don't go out there and just chase after rumors and gossip.
Okay, well, Congressman, we appreciate you coming here today. You've always been a great explainer, and this I know involves explaining things that you probably didn't know anything about 2 months ago. And we appreciate all the people who've sent in their questions. And I don't know if there's any last thing you want to tell, or tell people what the phone number of your office is again. Or
Sure.
Okay.
One, I again just want to thank the Advocate and the Times Pick for hosting. I want to thank, just the dozens and dozens of you that submitted questions, asked questions. I hope that the answers we gave were helpful and informative. If not, as Peter said, please feel free to reach out to our office. Our Louisiana offices are being rolled to our Baton Rouge office, which is 225-442-1731. Of course, you can call any of our Louisiana offices, Thibodaux, Livingston, and they'll roll to that number. Or you can reach out to our Washington, D.C. office, which is 202-225-3901. We have Facebook, which is Congressman Garret Graves, and our website has a lot of information, which is garretgraves.house.gov. That's Garret with one T, garretgraves.house.gov. www.house.gov, and a lot of information there that covers a lot of the questions that were asked as well.
Okay, and thank you all for joining us.
Thank you.
Okay.